A man is admitted with COVID. The wife complains, "This doctor doesn't know how to take care of my husband." The most appropriate response is what? "You're right, he doesn't. I understand that you want the best care for your husband. I'll get you another doctor." "You don't know what you're talking about. This is the best COVID doctor in the state." Rationale: always address the family's concern but remain non-judgmental. The nurse is about to bathe a client with methicillin-resistant Staphylococcus aureus with an abdominal wound covered by a dressing. What action should the nurse take? Wear gloves. Wear a gown and gloves. Wear gloves and a mask. Wear a mask.
Like, comment, subscribe.
Gloves and gowns are required if the nurse anticipates contact with wound drainage, incontinence, or a client who has an ileostomy or a colostomy. Masks are not required unless droplet or airborne precautions are necessary. What are the follow-up care instructions after a bone scan? Sleep for 8 to 12 hours. Ambulate at least 3 times before the end of the day. Drink plenty of water for 1 day after the procedure. Induce vomiting to expel dye. The client should be advised to drink large quantities of water for 8 hours to flush the radioisotope from their system. A bone scan uses radioisotopes, not dye. The only hazard to the client is trace amounts of the radioactivity of the isotope. Which action is wrong when performing CPR? Fingers resting on the chest. Straightens the arms and locks the elbows. Keeps the shoulders directly over the hands. Places the heel of the hand over the lower half of the sternum. To maximize the effectiveness of chest compressions, avoid letting the fingers rest on the chest. This also helps prevent accidental injuries to the organs. An irate man has a surgically wired jaw and has a prescription for a full liquid diet. The nurse should do what to help the client comply with his diet? Let him starve. Lecture him on the importance of good nutrition. Give him nutritional vitamins 6 times a day. Ask him what he prefers and blend those foods into liquids. Rationale: it is vital to have the client participate as much as possible. When assessing the pulse in an infant, where should you be assessing? Radial, carotid, brachial, popliteal. When checking the pulse of an infant, the pulse should be checked at the brachial artery. The short, fat neck of an infant makes palpation of the carotid artery difficult. Also, the pulse would be difficult to palpate at the radial or popliteal site in an infant. The nurse is about to change the bedding of a woman with localized herpes zoster. Her lesions are open and draining serous fluid. Which precaution should the nurse follow? Contact. Droplet. Standard. None. A client with localized herpes zoster with lesions that are draining should be isolated and placed on contact precautions to stop the spread of the infection. This communicable disease is not transmitted through air or droplets. The nurse discovers a 1-month infant unconscious and suspects a foreign body airway obstruction. To clear the obstruction, the nurse should do what? Attempt ventilation. Pray. Call the doctor. Perform 5 back slaps and 5 chest thrusts. Rationale: to clear bowel on an unconscious infant, the nurse should do 5 back slaps and 5 chest thrusts and repeat the sequence till clear. The nurse is about to help a client who can transfer with assistance from the chair to the bed. The nurse requests assistance from staff, but no one is available. What should the nurse do? Ask the client in next bed to help. Attempt to do it without assistance. Use a mechanical lift to transfer the client. Use an anti-static patient transfer board. Rationale: a client who requires assistance for transfer would never be transferred without the aid of less than 2 people, unless mechanical aids are used. The safest action is to use a mechanical lift to transfer the client. The nurse should do what to accurately determine the length of a nasogastric tube for insertion in an adult client? Guess how much tube to insert. Place the tube at the top of the forehead and measure by extending the tube halfway between the belly button and symphysis pubis. Place the tube at the tip of the nose and measure by extending the tube to the earlobe and then down to the xiphoid process. Place the tube at the tip of the nose and measure by extending the tube to the earlobe and then down to the top of the sternum. Rationale: to measure the length of tube needed, put the tube at the tip of the client's nose and extend the tube to the earlobe and down to the xiphoid process. The length for an adult is around 6 inches. A client has an intestinal obstruction with a bowel tumor of which is heard. Silence. Gurgling. High-pitched sounds. Wheezing. Rationale hyperactive, tinkling, metallic or high-pitched bowel sounds are characteristic clinical findings in patients with bowel obstruction. You, the nurse, are about to care for a child with measles. Which supplies should you bring to the child's room to prevent the transmission of the virus? Gown and gloves. Mask, gown, and gloves. Goggles and gloves. Gown, gloves, and goggles. Rationale, respiratory isolation is required, a mask, gown, and gloves should be worn. A nursing student transfers a client from the bed to the chair. The instructor intervenes if the student is doing what? Keeping the back, neck, pelvis, and feet aligned. Flexing the knees and keeping the feet wide apart. Encouraging the client to assist as much as possible. Positioning self as far away from the client as possible. Rationale when transferring a client, you should position yourself as close to the client as possible. The back, neck, pelvis, and feet of the person should remain aligned. Flexing the knees and keeping the feet wide apart help prevent injury. Encouraging the client to assist as much as possible will reduce strain on you. The nurse sees a janitor fall from a ladder. He is unresponsive. What method should be used to open the janitor's airway? Wait for the doctor. Tongue depression. Jaw thrust maneuver. Neutral position. Rationale if a neck injury is suspected in an adult, the jaw thrust maneuver should be used to open the airway. The nurse is caring for a 9-month-old child with scabies. The doctor has prescribed lindane to be applied to the skin to treat the infection. The nurse should do what? Discharge the child. Contact the doctor for clarification. Pray. Give instructions to the parents about how to apply the medication. Rationale lindane should not be administered to infants, children, who weigh less than 110 pounds. They may be at greater risk of serious neurotoxicity. Therefore, the nurse should contact the doctor for clarification. Breakfast trays are arriving, and the common practice on the unit is to assist clients to the bedside chair to eat. Which client will require the most help from the nurse? The client who underwent right hip replacement. The client who underwent left knee replacement. The client with a broke left leg. The client who had 2 toes amputated. When providing care for an indwelling urinary catheter, what is the safest option? Bathe the client before and after the procedure. Never clean indwelling urinary catheter, always replace with a new unit. Clean from the least contaminated area to the most contaminated area. Swab the catheter with alcohol pads. The prescription for a client reads cleansing enemas until clear. The nurse has administered a total of enemas, and the output is liquid brown. The nurse notifies the primary healthcare provider, understanding that continued administration can result in which outcome? The answer is acid-base imbalances, blood pressure changes, electrolyte disturbances, or blood glucose alterations. Rationale: if the nurse has a prescription indicating enemas until clear, the nurse can administer up to enemas, or per agency policy. If the output has not become clear after the third enema, the nurse should notify the primary healthcare provider because continued administration could result in electrolyte disturbances. The nurse understands that, which identifies a correct principle of surgical asepsis. The answer is a sterile package that becomes wet is unsterile. The nurse should hold sterile objects below waist level. A inch border around the edges of a sterile field is considered contaminated, or prolonged exposure to air will not contaminate a sterile field as long as the client's room windows and doors are kept closed. Rationale: when a sterile object becomes wet, the object becomes contaminated by capillary action from contact with unsterile materials. Any sterile object held below waist level is considered contaminated because it cannot be viewed at all times. A inch border around the edges of a sterile field is considered contaminated. A sterile field becomes contaminated by prolonged exposure to air. As prescribed, the nurse is applying a dressing to a client's wound that allows wound visualization, is waterproof, and is painless on removal. Which type of dressing material is being used? The answer is hydrogel, cotton gauze, hydrocolloid, or adhesive transparent. Rationale: hydrocolloid dressing material provides absorption, protection, and debridement. This type of dressing material is waterproof and painless on removal. Hydrogel dressing material provides absorption, protection, and debridement. It is conducive to use with topical agents and conforms to uneven wound surfaces but allows only partial wound visualization. It is also waterproof but is not completely painless on removal. Cotton gauze is a continuous dry dressing that provides absorption and protection and may be painful on removal. Adhesive transparent dressing material provides protection for partial thickness lesions, debridement, and serves as a secondary dressing. This type of dressing provides good visualization of the wound, is waterproof, but is not painless on removal. The nurse is administering enteral feedings via a nasogastric, NG, tube. The nurse should take which action when caring for this client to maintain client safety? The answer is do nothing. Change the NG tube with every other feeding, check for tube placement and residual at least every few hours, or increase the rate of the feeding if the infusion falls behind schedule. Rationale: a complication of an NG tube is aspiration pneumonia caused by regurgitation of formula contents from the stomach into the respiratory tract. This risk can be minimized by checking tube placement and residual and by keeping the head of the bed elevated to 0 degrees at all times. NG tubes may be left in place for months depending on the type of tube inserted. A client who is lactose intolerant should be instructed to supplement calcium by eating what? The answer is dried fruits, yogurt, cream cheese, or 2 cups of milk. Rationale: leafy green vegetables, broccoli, nuts, legumes, and dried fruits all have calcium.